There is this constant universal tension in modern healthcare that just drives everyone crazy. It is this tug of war between maintaining absolute clinical excellence and dealing with the reality that hospitals are operating on razor-thin margins.
Right. Yeah. It usually feels like a zero-sum game. You can either save lives or you can save money, but you really cannot do both at the same time.
Exactly. But for you listening today, we're doing a deep dive into a model that suggests you actually can. We are looking at the stat nurse model, which comes from the work of Timothy Simpson,
Yeah, and he is a CCRN with 22 years of ICU experience who transitioned into an AOD role.
which normally stands for administrator on duty, right? I mean, when nurses hear that, they usually think of someone managing bed flow or, tracking down lost property.
Right, not exactly a clinical resource, but that is the friction point Simpson identified. He took that administrative authority and combined it with his clinical background. He basically became a fluid resource that actually intervenes at the bedside to solve real daily problems.
So instead of just looking at spreadsheets in an office, he is out there mentoring and troubleshooting. And he broke the value of this down into three specific buckets. The first one being sepsis management.
Which is obviously a massive driver of costs and mortality. Because the stat nurse is actively looking for trouble, they catch indicators early. His data shows this role prevents about 10 ICU days a month.
And honestly, 10 days might not sound like a massive number at first glance.
It does not, until you look at the price tag. An ICU day runs about $4,300.
Wow, so preventing 10 of those a month.
Protects roughly $516,000 a year, over $500,000 just by keeping patients on the regular floor instead of the expensive unit.
That is incredible. And the second bucket is something you hear about everywhere right now, which is nurse retention. How does one single stat nurse actually fix a systemic culture issue like burnout?
It is the lifeline effect. New nurses often feel like they are drowning, and they do not want to bother their busy colleagues. The stat nurse is explicitly there to mentor and help them.
Because they actually have the time and the mandate to do it.
Exactly. And the model estimates this support retains at least 10 nurses a year who would have otherwise just quit.
And replacing an RN costs, what, like $60,000?
Conservatively, yes. So keeping those 10 nurses saves another $600,000 a year in turnover costs. Plus, you get to keep all that crucial institutional knowledge in the building.
Okay, so we have ICU savings and retention savings. But there was a third metric in the research that sounded a bit technical. Failure to rescue. Can we translate that for the listener?
Sure. It basically refers to failing to prevent a patient from deteriorating into a serious adverse event, like a code blue or an emergency surgery.
The total nightmare scenario where the signs were there, but nobody caught them in time.
Right. And the stat nurse assesses at least 20 high-risk patients a month. The model assumes a very conservative success rate here.
Which is just preventing 1 out of those 20 from crashing.
Yeah, just one single save. But even that one save a month is valued at $25,000 in risk and cost, which adds another $300,000 a year in value.
Okay, so let us look at the big picture here, because the final calculation is just wild. The investment to hire the stat nurse with salary and benefits is listed at $150,000.
Right.
But when you stack the sepsis savings, the retention, and the safety improvements, the return is roughly $1.42 million.
Which gives you that staggering 844% return on investment.
844%. I mean, if you went to a CFO with an 844% return on a stock tip, they would laugh you out of the room.
They really would. But this is hard data based on actual cost avoidance. It flips the entire script. It proves that paying top dollar for a highly experienced nurse to simply be available is not a luxury or a nice to have.
It is an absolute necessity for financial sustainability.
It is the most cost-effective strategy a hospital can implement. Investing in clinical quality essentially pays for itself 8 times over.
So for you listening, here is the question you have to ask yourself after hearing these numbers. If a single role can generate an 844% RMAY while saving lives and keeping your staff from burning out, what is stopping every single hospital administrator from implementing this immediately?
That is truly the $1.4 million question.